Hi, I'm Dr. Jack Blum, and I want to welcome you to Blum Chiropractic and Acupuncture, and I want to thank you for visiting us here at chiroblum.com. Please check out some of our other videos if you want to learn a little bit more about our clinic. There's some helpful information in there, and you'll get a feel for kind of what we do here at Blum Chiropractic. And one of the videos you might want to check out is just what makes us unique from everybody else. The purpose of today's video basically is just to kind of touch on some questions that I get pretty much on a regular basis by new patients or patients that possibly might want to come into a chiropractic office, not specifically just mine, but if you're kind of on the fence about whether to visit a chiropractic office, some of what I'll be talking about here in just a couple minutes might be of benefit to you, because in certain situations you do get asked some questions about what we do and how we do it, and I thought I would just share with you some of the questions I get that probably are most common, maybe out in a social situation when somebody finds out I'm a chiropractor. So if you get a chance, stick around for a couple minutes, watch this video, and hopefully you'll have a little bit more information than when you started. One of the questions, usually a lot of times over the course of my entire career, I've heard that we are not real doctors. Well, yes, we are. We are real doctors. In fact, the DC after my name does stand for Doctor of Chiropractic. Now, one of the things that a lot of people do not know is what our education consists of. Now, our education pretty much parallels the medical doctor's education. We get most of the same training, we get most of the same courses. Chiropractic education does consist of a lot more of the physical medicine services, so we are doing a lot more of the basically chiropractic physical therapy, the physical therapy modalities, the exercise rehab, things like that. A lot of our courses are very spinal related, of course. A lot of neurology, orthopedics, those kind of things too. So we get pretty much all the classes that you would typically expect to find through the medical training. Our internships are a little shorter, but in Illinois we can do just about anything a medical doctor can do, with the exception of prescribing medications, and we cannot inject. But beyond that, we also, your postgraduate training, you can get into neurology or orthopedics and take that further as far as your training goes. So like I said, the state of Illinois is very liberal, and we're very comfortable being able to practice the way we do in this state within our scope of practice. Another question I get is that I hear you have to go weekly or forever to your chiropractor. That's a huge misconception. There are physicians out there that will try and require you to come more and more, but any good physician out there, he or she should basically have you in their office until your situation is stabilized or it's beginning to resolve, and then at that point the treatment plan should be tapered off a little bit. The frequency of what you go should be tapered off. As your situation resolves or it starts to stabilize, then you shouldn't have to go to your physician as often. There are patients out there that will get on a wellness program after their situation is stabilized, and just do it as a wellness, like I said, a wellness program. And basically my philosophy is that I think you need to decide what your priorities are relative to your care. Some patients take very good care of their eyes, some patients take very good care of their teeth, other patients want to take care of their spine, and chiropractic is probably the best way on the planet to be able to do that. So those are some of the things that I recommend, and it's important that the patient has a say in what type of wellness care they're going to have if they want to participate in any type of program at all. So that's kind of my philosophy. I don't push wellness programs on anybody. If they're interested, then I'll give them some recommendations. Okay, another question I get is, what is the popping noise that an adjustment makes? Well, number one, it isn't your bones cracking, and it is not the joints rubbing together. In fact, the noise that you make when you pop your knuckles and you hear that little pop in there is basically, it's a nitrous gas building up within the joint space. what an adjustment does is, and when you pop your knuckles, you're basically separating the two joint surfaces very quickly at a very minimal distance. And that's what causes basically a cavitation within the joint, and that causes the gas to build up, and that's the sound that you hear. Apparently, up until the last probably year and a half, the theory was that it was just the opposite, that it was gas escaping the joint. But there was a study done where a gentleman had his finger popped, 10 times over the course of maybe a day, and they used a kinematic MRI to monitor the adjustment, and it showed that that there was a buildup of gas within the joint. So it's 100% opposite of the theory we've known for forever, as far as I've been a chiropractor. So adjustments that you hear, you adjust a neck or a low back, sometimes you're going to get a pop, you're going to hear that sound. But that helps with the integrity of the joint. It helps provide mobility of the joint. It helps relaxation of the surrounding musculature, especially along the spine. There's a global relaxation of the muscles when after an adjustment, and it also provides mobility and can help decrease the effects of a pinched nerve. So adjustments do a lot of good physiological things. So they're pretty important for most patients. Another question I get is that do you guys only treat backs and necks? That's probably one of the biggest fallacies out there, is that we do more than that. Obviously, I've told you what our education consists of, so yeah, we can treat just about anything. We treat patients that have a variety of problems, anywhere from migraine headaches to fibromyalgia, and along with that, we also use nutrition. As the medical doctors are going to use the pharmaceuticals, we're going to use nutritional supplementation, because almost every problem has a nutritional component to it. So we recommend supplements on a regular basis to treat nutritional deficiencies that are associated with whatever issues that you have. And most problems that we run across in this facility has a nutritional component, and oftentimes there's a genetic component, and that genetic component is usually somebody in the family tree has got a similar problem to you. So, and if they do, then you're more at risk for having that problem. So in closing, I hope that answers a few questions. If you have any other questions, you're on the fence about coming in to talk to someone, give us a call at my office, 630-351-4700, and hopefully we can answer any other questions. You can come in for a free consult. I'll sit down and talk to you as long as you feel like talking. We'll set something up where we'll have plenty of time to come in, and I can answer each and every one of your questions. So thank you for visiting with us today, and I hope to see you soon. Thank you.